Tuesday, March 24th is the day to mark on your calendar. It's the American Diabetes Association Alert Day. Dr. Robert Reznicki is here to tell us how on that day, or actually any day, we can determine if we are at risk for developing diabetes. Dr. Reznicki is the Chief Medical Officer at Medical Mutual of Ohio. Welcome to the show.
Thank you so much.
Now, before we focus on exactly March 24th, let's talk a minute about why do we need an alert day for diabetes?
Diabetes is a terrible disease for the United States and for the world. Do you know that in the United States, we have 30 million diabetics now? That's 1 in 10 Americans.
Wow.
But more importantly than that, Lori, 86 million Americans are on the brink of developing diabetes. And we'd like to talk a little bit, not about the management, but about that group that we can prevent them from getting diabetes.
Okay, we talk about that as something we want to do, but why is diabetes so dangerous?
It's an awful disease. Not only does it affect the blood vessels and produce gangrene of the legs and terrible problems, it affects the nerves, it affects the entire body in ways that produce terrible problems, not just for the individual, but for the whole family.
Wow, okay. If it's diagnosed, though, you can treat it, right?
That's absolutely right. We can manage it. If we diagnose it, we can manage it. But what we'd like to talk about are how do we keep people from getting into that position where they need all those medicines for the treatment of diabetes.
Prevent rather than try to treat it.
Exactly.
So the Diabetes Alert Day is the first step because it can help us determine whether or not we have a risk for diabetes, correct?
That's absolutely right. And what we want to think about is what are the factors that maybe are going on in a given individual now that might lead to developing diabetes. And if we can get people to do a simple test and look for something in their system at diabetes.org, for example, where we don't want them to do it during this program, but when this program is over, if they could go to diabetes.org and take a test that has 7 simple questions in it, and then that can key in whether or not they have a problem with diabetes.
Okay, so can you give us a pre-test?
Sure, we would love to do that and give you an idea what some of those are. Now, some of those are if you've ever been diagnosed with high blood pressure. That's a risk factor for this disease. How old are you? Unfortunately, many problems develop the older we get, and this is no different. And a final one, just to mention as an example, is the gender. And males also are at higher risk for this. But those factors, if you think about them, we can't fix those, can we? And so as you take this test, it will modify certain factors for you that you can do something about, like your weight, and being inactive. And most importantly, it will offer some preventive tips at this site.
Oh, good. Okay, so you take the test and it also kind of give you some feedback about what you should be doing.
That's right.
So.
And keep away from getting to be managed in diabetes, but prevent it.
Okay. Do we have to wait until that day in March to take care of this test, or can we do it anytime?
You can do it anytime, and as soon as this program is over, I would advise doing it. Just like we do New Year's resolutions, or we have a smoke out day, because we are procrastinators.
Yes, we are. Isn't that unfortunate?
But you can take this test anytime, but by all means, don't go beyond this date without taking this important test.
Okay, great information. Thank you. Many of us could have diabetes or pre-diabetes and not even know it. Don't gamble on your health. Take the diabetes risk test and share the results with your doctor. My thanks to Dr. Reznicki for alerting us to the Diabetes Alert Day.
Thank you very much.
Find out more about Medical Mutual of Ohio by visiting their website, www.medmutual.com/2015options, or call 1-866-488-3266. Next,